I'm Meshal Malik and welcome to Indus Special. While figures show that men are hit harder by the coronavirus, health experts and activists claim that the secondary fall of the pandemic will devastate women to a far greater degree. Let's discuss this further. Joining us for this conversation is Alanna, Shaikh, who's a global health consultant and who specializes in strengthening health systems. She joins us from Colombo. Also joining us today is Ms. Maleeha Hussain, who's the executive director at Mehergarh, a center for learning. She also has an extensive experience dealing with human rights issues, especially concerning women. She joins us from Islamabad. Thank you both for joining us and a very, very warm welcome to the show. Ms. Alanna, Shaikh, let me begin with you and let's set the premise for the discussion to follow. Let me ask you, when we're talking and having discussions about health crises or any crises in general, what factors do we need to keep in mind in order to understand how these crises impact men differently than women and how women are uniquely impacted?
So any kind of health crisis or crisis situation in general is going to exacerbate any existing inequalities between men and women. So basically any challenge that already exists is going to get worse when the situation is put under great stress, like the great stress of COVID-19.
Right. So under this great stress of this pandemic, we will see inequalities that already existed prior to this crisis being exacerbated. Ms. Maleeha Hussain, from your unique lens, because you deal with social issues, you deal with many other factors that impact women, how have you seen that happen? How have you seen inequalities being exacerbated during this time?
Actually, if I share my, may share my point of view, what I have seen in the last almost 5 months now is that on the one hand, it has, like Ms. Alanna Shaikh suggested, that the inequalities sort of increase and women are put in a more difficult situation. But on the other hand, I have also experienced that a lot of women, their lives have become comparatively easier because of this pandemic. If they were going to work from 9 to 5, going to their workplace, whether it was the elderly in their families or the younger children in the families that they had to leave behind. Because of this pandemic, we have been pushed to look at other possibilities of what can be done. Women have been able to stay at home, take care of their responsibilities at home and work from home at the same time, which sort of gives them the flexibility of taking care of all of their responsibilities, work-related and home-related. So I look at it in a both positive and negative way, not only negative for women.
Ms. Hussain, to your point, specifically, this one that you talk about, women being able to manage both their domestic roles better and their professional roles better, your point is very valid and very well received, that it creates this flexibility needed for women to operate in those roles. But at the same time, doesn't it create a double burden on women? Because if a woman is professional, she's working outside of the home, she does not have to keep up with those domestic obligations all the time. But when she's at home, she has to play both roles.
If you really look at the reality of women in Pakistan, and the reality of working women in Pakistan, they actually are taking care of both the responsibilities. They are responsible for everything at home. Even when there are other people doing the actual work, it is still their responsibility to make sure that the food is cooked, the house is clean, everybody gets their food on time, everybody gets their medicine on time, the kids have their homework done. So it is their responsibility. Even when they are not at home, it just gives them the flexibility, the work they are already doing.
All right.
But because of being at home, if a child is not well, say for example, they can keep an eye on the child. It's instead of when they were in the office working from 9 to 5, they were thinking about the child, worrying about them, calling every hour, every 2 hours to see how the kid is doing. But when they're at home, they were able to take their laptop to the children's room, to their parents' room, do the work, stay on the phone and on the laptop.
Right.
Take
Ms.
care of the
Maleeha, stay with me. I want to come back to this, and I want to talk about what you expect will happen once this work from home situation is changed. Because in many countries, we're seeing schools reopening, we're seeing workplaces reopen in order to get the economy to start. So do you think that there will be long-lasting implications of this pandemic right now in exacerbating those inequalities? I'm going to come to that point, but I'm going to go back to Ms. Alanna Shaikh and talk to her about something that Ms. Maleeha Hussain talked about, not having to leave the home. Ms. Alanna Shaikh, if we take, we adopt the lens of a health specialist, your lens basically, and talk about women not being able to leave the home, that also providing certain amount of flexibility and comfort to them, but also that denying them essential healthcare services. How do you see that?
So we've seen with a lot of infectious diseases and now with COVID-19 that women have more trouble accessing testing and accessing treatment because of limitations in cultural traditions around women using transportation, where women can be in public and where women can be alone. In addition to, as Ms. Hussain mentioned, the challenges of leaving behind family responsibilities. So if a woman suspects that she has COVID and she wants to get tested, how is she going to get to the testing site? Does she need a man to go with her? Is it a site where her family is comfortable for her being, and who's going to look after the children while she's off waiting to get tested? So it's more of a logistical and emotional challenge for women to access these kinds of services.
So, Ms. Alanna, let me connect this to what I said right in the start, which is that we are seeing reports coming out that state that men are more susceptible to this virus, that they are, we see infection rates impacting men to a greater level. Do you think that could be because women have not been tested as much?
The data that I have seen indicates that once men are infected with COVID-19, they are more likely to die of the virus. That's what I have seen. And so that would not really be affected by testing numbers. So I'm not sure that that is the precise situation. And we've seen in many historical situations where, men die younger than women. Men tend to be more vulnerable health-wise, and that might be biological, and it might be about their relationship with health and healthcare.
Right. I take your point there, and I understand the constraints of being able to make these conclusions at this point of time, because it is an evolving situation. So much more research is needed for that. Ms. Maleeha, and going back to the point that I said we will talk about, which is after this pandemic, and something that we're already seeing happen, that bosses, workplaces are calling back their employees, telling them to sit within offices. That impact that happened during the pandemic, which is exacerbating certain inequalities, will that be felt now that those privileges that you talked about, that greater flexibility that came with the pandemic, being able to work from home, that is taken away? Will we see a more negative impact?
Meshal, actually, a lot of people are very curious about what will this new normal look like. We have no idea what it's going to be like, because this is something very new. We can only speculate what the new normal will be. People have started going to their offices, not all of them. I know we haven't started our office. A lot of civil society offices are not open yet. In some of them, only the essential staff is going. Those who have to, those who can do their work, still do their work from home. They are not going to the offices yet. But as things get better, they are improving really fast in Pakistan. And we are very hopeful that they will continue to improve with time. In the next few weeks, or definitely in the next month, we will see a lot of offices opening. So as far as businesses that have suffered, opening of those businesses will improve or start improving the hardships that they've had to go through. For example, the restaurants, they were closed. A lot of other small businesses were closed because of the lockdown. as things are improving, some of them are opening.
Ms. Maleeha Hussain, if I could interject here, I'm sorry to cut you off, but if I could just interject here and quote something from the World Economic Forum, an article that was released. I'll just read it out verbatim. The world's economy is projected to contract sharply by 3% in 2020, and poverty is set to rise for the first time since 1998, bringing 40 to 60 million people into extreme poverty. However, unlike previous economic crises, this crisis will negatively affect women more than men, creating a significant blow for gender equality. What do you think this means?
If you look at the situation of Pakistan and compare it to the global situation, ours is actually very different. We don't have that many women in the workforce. So if you are comparing it to some of the other...
So won't this time create that hindrance in actually entering the workforce to begin with?
Yes and no. Because already a lot of organizations, even government departments have been making an effort to increase the number of women in the workforce by improving the work environment, by creating more opportunities. And it has worked like quite a bit, and those efforts will continue. So there are comparatively fewer positions, fewer businesses where women were impacted negatively. There were some men's businesses or work that was very seriously impacted because of COVID. So not only women, but if you look at the society, we can't get women like in isolation. They are a part of the society. So whatever their economic status was, in their families, it depends who was bringing in the earnings. Mostly it was men. There are quite a few actually, households headed by women. Depending on the nature of the work, some have been impacted negatively, others have not been.
Right. Ms. Maleeha Hussain, I'm pressed for time. I'm sorry to interrupt here, but there are some things that I need to, questions I need to also put to Ms. Alanna Shaikh. Ms. Alanna Shaikh, we've been talking about the economic repercussions of all of this. We're talking about how this will impact women. Ms. Maleeha Hussain makes that argument that in Pakistan, things are improving, so women will not be impacted that much. But from a health point of view, this is something that I want to take to you, which is a point that is being specifically made in regards to women and reproductive health, maternal health care, in access to it, and that being the first thing that suffers when you see a health crisis. Give us more insight into that.
So in terms of COVID-19 in particular, enormous numbers of women lost access to routine reproductive health care and to pregnancy care and to prenatal care, because when they started limiting access to health services to stop the spread of the virus, it also meant that women couldn't go in for things like prenatal appointments, and it meant delays in identifying high-risk pregnancies. It meant reduced access to being able to deliver in a safe place, maybe having to wait for time on the maternity ward. It meant that maybe women weren't able to access maternity care services and ended up delivering at home. And so there has been a huge medical impact on women because they have the need for these kinds of services.
Right. I take your point. Now, Ms. Alanna Shaikh, when we are discussing the fault lines that have been made more evident during this time, those have deepened during this time, and we continuously talk about pandemic preparedness, how in the future, when we're hit with another pandemic, which experts are saying we will be hit with, can we try to rectify the mistakes we made this time around? In terms of the issues we've discussed today, those that have threatened women, specifically those have undermined their access to healthcare, all these issues for the future when we're trying to strengthen healthcare, global healthcare infrastructure, what changes do we need to deal better with health crises?
There are a few things we need. One of which is we need the ability for health systems and governments to react faster when they realize that there's an epidemic coming. That the countries that recognized the problem of COVID-19 in China and got ready in terms of preparing supplies and thinking about access to healthcare did better than the countries that didn't. The next thing we need to do is approach this from an access lens. like a deep focus on making sure that people can keep getting health care no matter what's going on, even as an infectious disease tears through society. And then the third thing to think about is in terms of resilience and decision making, about trying to make sure that decisions are guided by what's best for people and what will improve people's health, and not politics or other pressures.
Right. Ms. Alanna, I'm going to try to be sneaky here and ask you a question that kind of links to my conversation later on in the show. But I think it's an important one to have, which is, do you think had women played a more active role in the decision-making process, in making calls regarding what should be done during this pandemic, we would have had a different outcome?
If you look at the profession of global health and public health, it is dominated by women. Especially at the mid-levels. And if those women were at the higher level and making more decisions, then yes, I think we would have seen better decision making. And on the global level, if you look at the big global health bodies, if you look at the responses in the different countries, when women play so many leadership roles in global health, why were they not at the table in the very beginning making the decisions about COVID-19? So we shut out some of our best experts because of sexism, and then we made a series of poor decisions. So yes, including all of your experts leads to better decision making.
Right. I fully condone your statement there, not just as a woman, but also from the evidence we're seeing, which is countries that have female leaders, not just health experts, but female leaders have dealt with this pandemic in a better way, perhaps due to empathy or compassion. Ms. Maleeha, I'll send one last question to you, which is regarding education and gaps within education that perhaps have deepened during this time. Evidence within Pakistan also suggests that. What do you see happening once this pandemic is over for little girls trying to get to school?
In Pakistan, if I look at overall, if you look at the high schools, that seems to be, it's expected to stay the same. If you look at the universities, there things might be a little different, and not necessarily because of the pandemic, but in Pakistan there have been some other issues in a few of the universities, even though people are working on those. But because of the pandemic, I know the universities were closed. I know that slowly they are starting to open up, but only allowing students who were either in far-flung areas and did not have internet access. Just they've asked those students to come back on campus in the hostels, making sure that they're following all the protocols, but no major shift because of this pandemic. We have to see that it's only been 4 months, and the systems that were here already existent, the number of female students has already been very low. New female students going to schools, even though the government is trying, a lot of people in the civil society are trying to increase the number of female students, but I don't think it will be impacted as much because of this pandemic.
All right.
Because it's only a short period of time. Yes, things were very difficult, but slowly they will go back to normal, or as I said earlier, we'll have to see what this new normal will look like. We have no idea what it'll be like, but we will see.
Definitely. I agree with you there that we're going to have to see what the new normal looks like, but just trying to give the flip side to all the arguments and the analyses you've presented. International organizations, the United Nations, UNESCO, all have claimed that this pandemic will perhaps exacerbate gender inequalities, and also specifically in the sector of education. What happens in Pakistan, because Pakistan has dealt with this pandemic better, is of course yet to be seen, but that is the general consensus that this will happen across the world. Thank you so much, Ms. Maleeha Hussain, for joining us from Islamabad, Ms. Alanna Shaikh for joining us from Colombo. We're going to go for a short break, but when we come back, we're going to have another topic for you, so stay with us. Welcome back. There is a growing awareness in South Asia regarding gender-specific violence. This comes as more cases are reported either by the authorities or by the media. There is recognition of the fact that sexual violence, domestic abuse, mental, physical, or emotional disproportionately impacts women. But this is precisely where we have to move forward and think of ways where this can be tackled. On today's show, we discuss how important it is for women to participate in public affairs and especially in politics in order to reduce violence against women. Joining us for this conversation is Ms. Maryam Wardak, who's a journalist joining us from Washington, D.C. Also joining us today is Dr. Ranjana Kumari, who's the Director of Center for Social Research in Delhi, as well as the Chairperson of Women Power Connect, a national-level organization of women's groups. She's also the author of Reign She Will, Women's Strife for Political Space, Women in Decision-Making, Women Parliamentarians. She joins us from Delhi. Thank you both for joining us and a very, very warm welcome to the show. Dr. Ranjana Kumari, let me just begin with you. And I'm going to start from the very basics to ensure that our conversation is understood and welcomed by all. Let's start from that very essential point that there are some very tangible issues that prevent women from participating in public spaces, whether it's transportation, whether it's in access. But then there's some invisible factors. What are those invisible factors that continue to persist and prevent women from going out, stepping into public spaces?
Well, public place, the moment women step out, there is always a fear of the other. And this other is the men in society. We have had cases of public place violence, which is growing in South Asia. We have had rape cases where the brutality has been inflicted beyond imagination. And it took very long time of struggle by all of us to get justice to women. But the most important reason when you talk of public domain, I can think of politics as a public domain or public life as a public domain. And violence against women in public life through one of a very, very deep research that we conducted in India, Pakistan and Nepal. We had a substantial number of sample size. We did a very intensive research and we found that women are discouraged from entering the public place by the political party colleagues, by people in the families. It starts from the family, of course, because family fears for their safety not only physical safety but also in terms of character assassination, in terms of giving them all kinds of bad names and calling names to such people who remain strongly in public arena and public life, and also the others who want to enter fear it. So fear factor is being inculcated systematically, where women are physically hurt also. We have had when first time women started entering the panchayat election, which is a local body where women were given the reservation. We know of the cases where women were beaten up, burned. So many such cases happened. But then slowly it got normalized. And now when you look back and see how women have performed, initially they were under the control of the male colleague, but then now today they are accepted as a leader.
Right.
So the moment women start going out, the violence against them is used to inculcate fear and to stop them from taking the step out.
Ms. Maryam Wardak, Dr. Kumari makes very essential and very strong points here. Your personal experience as a female journalist, someone, we all know journalists having to negotiate and having to, break certain boundaries. How much of what Dr. Ranjana Kumari states about violence being created in order to prevent women from entering public spaces, how much of that resonates with you?
Well, aside from being in the field of media, I do run an organization called Her Afghanistan that supports women in tech, security, peace, and foreign policy. And in my experience working in Afghanistan, especially in the past 10 years, and working at the leadership level at the National Security Council, I have noticed from the simplest form to the most aggressive form of abuse, whether it's psychological or physical, I've noticed that it's most of a component of fear and the conservative traditional role that a girl must stay into, and it has to do with the fact that we don't have any examples of how women could be in public spaces and how it could be acceptable in the culture, especially in Afghanistan versus other South Asian countries.
Right. Ms. Mariam Murdak, I'm sorry to cut you off here, but since you make such an important point, I would just request if you could perhaps give us an example so it provides us greater insight into what you're saying when you say the gravest form of psychological barriers or violence inflicted upon women and physical violence.
So, for instance, we had a female pilot who was the first pilot in Afghanistan about 4 years ago. And her name, I believe, is Naeed. I forgot her last, Nilufar. Nilufar was basically a phenomenon. She was receiving all this media support, and the government was behind her, and the international community loved her. But all of a sudden, her fiance broke up with her because of the publicity that she was getting and how it was unacceptable for a girl to fly. Her family started to stop talking to her. And these are all psychological forms of abuse, isolating her. Her friends were not speaking to her. She found herself all alone. And not only herself, but her family, her mother, her sisters. They were all getting isolated to the point that she had to leave Afghanistan. And she left being a fighter pilot in Afghanistan and started flying commercial in the United Arab Emirates. So these are examples of how women have been suppressed in many ways. I think we have one female icon during the Mujahideen era when we were fighting against the Soviet invasion, during the Soviet invasion, where she was a female Islamic scholar and she became the spokesperson for the Mujahideen. At that time, when she became the spokesperson for the Mujahideen, she was the only female. Icon at that time, and it gave a very little leeway for females. But because we didn't have that much role in media in Afghan households, she became more of an icon in the region versus in Afghan homes.
Right.
So these are the kind of examples that I can give you. Currently, Afghan females...
Ms. Mariam Murdak, I'm sorry to interject here. The examples you give are harrowing. And of course, there's something that stirs sentiments within women all around the world, because in some form or shape, women can resonate to what happens when they achieve success or when they try to move towards social mobility or even step out of their homes. We hear these incidents so often. Dr. Ranjana Kumari, one of the things about violence is that those who perpetuate it enjoy a form of impunity. Why do you think men still, especially when we look at the context of South Asia, continue to enjoy that impunity of being able to do whatever they want and there not being repercussions for it?
A lot of public place violence was never recognized. And also, in some sense, there was a social acceptance that if you go out of home, you deserve this, or if you go out of home, this is bound to happen to you. So we did not have laws to protect women. In fact, most of the laws have been created after, most of the South Asian countries after 2020, because laws have really not been, 2010. I mean, that's where we start 2005, 2007, 2009. So domestic violence, the law was in 2005. Then we had sexual harassment at workplace law. So lots of those issues in terms of protecting women and giving them the tools and wherewithal to start, using the law to protect themselves and dare to be in public places. And if something happens, it will be dealt with, legal tool that women have to protect themselves. But, this is not something which was really given to women. Women had to fight for it. We in the women's movement had almost decades and decades of struggle to be able to get these laws in place, especially in India. So impunity is a kind of social consensus and acceptability. As men think together, or society thinks together, that women need to live a life of subordination. They must not have a strong voice. They must not have a strong position. They should not participate in decision making. So if this is the mindset that traveled through generations, if anything happened to women, they were really blamed for it. So victim blaming is the psychology of our societies, that if women go, they dare, they speak, they raise their voices, then they will be meted out with that, and basically to control them. So that's the power relations, which really gives impunity to men and make women look like the ones who have perpetrated or who've been there, so they deserve it. So you have to protect.
Right.
That's why this impunity that you see in our societies.
Right. Dr. Kumari, I hear you, and those words are strong. I'm going to move on this discussion along and focus on the next part of what we're supposed to talk about, which is if women participate more in politics, in the realm of politics, in the realm of government institutions, can we see and can we hope that this violence against women will decrease or will be more actively targeted? Dr. Kumari, you've done extensive work on this, so let's hear what the insight you can give us.
Our studies which really have looked into the role of women and their acceptability as women leaders, two conclusions I can very easily share with you. One, that wherever women are elected representatives and have been able to deliver or have been allowed to deliver, their likelihood of they getting re-elected is very high. That means that women are acceptable as leaders by the largest society, by the people of the village, and village is of course much more conservative than the urban areas, but they are really getting re-elected. That means that they have been able to establish a kind of leadership. Number two, also is important that there has been a direct one-on-one relationship between violence against women and women becoming political leaders, getting political voice. They are able to participate in the decision making. There is a direct relationship. So the violence has decreased in the areas, in the villages, in the panchayats where women have come as formidable leaders. So A, that they get elected, their leadership gets normalized and established, and B, that women the violence decreases wherever women are leaders. So it is very important. That is why to ensure that more and more women come into politics and more women start occupying positions of power and decision making. If that's what will start happening, certainly women will get empowered. So far, the discourse goes on within the patriarchal thinking that we will protect you.
Right.
We will protect you means that the men sitting in power will
elect us into power so we can protect you. I hear you there. Ms. Mariam Bardak, let me go to you and talk to you about all that Dr. Kumari has stated here, such very important points, but something that I want to take and discuss as your observation. When women do enter political roles, do you feel like there's a pressure on them to pander to the same misogynistic values and arguments that women are expected to fight against just because to gain that popular support, to be re-elected again, as Dr. Kumari stated?
I don't think that it only applies to women in Afghanistan or South Asia. It applies to women all around the world. Even if you currently look at all the women leaders, if you notice that they're adhering to more traditional values, whether it comes to the superficial of clothing or if it comes to their own social status. In Afghanistan, where men make decisions around the dinner table, because it's a very social country and people have many dinner gatherings. But women, however, cannot stay out as late as men. It's not appropriate. Many do, of course. There are situations where women, especially some that are in leadership, are in those settings, but it's not deemed appropriate by the public. Many of the arguments that currently take place is that the women that are in leadership in Afghanistan are there superficially. They don't have any authority under their roles. They don't have executive power. So the question is this symbolic progress? Is it making any strides for younger women? These are arguments that I constantly have, especially when we do advance our women. I'm very proud for the position that they take, but they need executive power because it's reinforcing the same values. When a woman is there symbolically and she doesn't have any authority, it sends that message that, well, there's really no need for her for the girl to advance and be in public spaces because she's only here for photo ops or just to keep the international community satisfied. So when you see even women in school settings, they're much more traditional. In my time in Afghanistan, I had to adhere to the traditional values only to be accepted also by the public. So if you do not play a part of society, you will not be accepted in society. So it's such a tricky situation for one to play the part, but then to bring changes up in your own role. I do hold many women responsible who have a role in public spaces, but they don't play a role to advance women. One of the key points of my organizations was to send young girls abroad for education and make sure that they return. And the conversations that I had were in the homes of these young women with the patriarchal head and explained to them that she won't lose her cultural values, she will just advance, and how this will economically support the household. But then also have to explain and train to the young girl, like, don't you lose yourself in the process, advance mentally, advance emotionally, but you have to make sure that you keep certain values so this doesn't stop your younger sibling or other relatives to go abroad. It's such a thin, sensitive line, and I feel like the government has responsibility on evolving the whole country. We have to make sure that we don't only evolve in the urban areas. It has to really start from the rural areas, because we've had this issue when Queen Soraya, who was married to Amanullah Khan, King Amanullah Khan, and she made great strides for Afghan women. But the minute she went to Europe and a photo of her was published with sleeveless dress, the whole country backfired, and all the strides that she made, whether it was allowing women to divorce or to have co-ed schools and private schools for women, all of that shut down and went back to the way it was because just of her attire. So there's so much sensitivity here.
It's almost like, and you say it best, it's almost like it's such a tricky situation. It's such a fine line between being able to participate in public, but even if you're there, even if there's visibility of you being there, the actual power that should be given to women is denied. They are denied that power. They are denied from actually participating in the decision-making process. Dr. Kumari, so when we're talking about women participation, it seems like at this point, even if women are participating, they still have to operate within the patriarchal structure, which we understand. But within operating that, how can they and how can governments ensure that they're not just reduced to symbolic representation, but they actually do have a say?
Well, I agree with the kind of setup we are in at the moment and the kind of patriarchy that we are all dealing with in every one of our countries. Even if women have moved in the power arena, they have been under a lot of control. But then at the same time, we do have role models which are emerging as independent women leadership. And these are the women who are coming through a lot of struggle, being with people, getting people support. They are spending a lot of time in delivering to the people, getting their lives better from where they come from. So I think the women who emerge out of the struggle and become independent leaders, and also women who are coming from political background and families, they are also doing quite well in our part of the world. But at the same time, I think both have to move. One, that we parliaments will have to move and start giving women the spaces. Till you sit on this chair, you will not know what this power is all about and how you will use this power. So I think it's important that parliaments start, we are for 29 years struggling to get equal, 33%, not even equal, position in our Indian parliament. And it's been 74 years of independence. The bill has not been passed, even not in, now of late, not even discussed. So certainly it's a long drawn struggle. But at the same time, I would say that a lot of women are really daring it. They are coming forward. We may have to pay price for it. Some of us have paid the price and are paying the price. But, this is and there is an aspirational growth at the grassroots level, at the village level among the women, to come forward, to get educated, to get employment, to be able to join politics and work as political leaders. So that aspirational, push is coming from the bottom. And also, if there is encouragement and we are able to put pressure on the people sitting in positions of power and who are not leaving their seats for women, to leave those seats and give women equal right, because after all, we all are at the moment democracies and are governed by our constitutions. And every single country we have constitution which gives us equal rights. And if that equal right has to be realized, women have to get into positions of power to be able to realize the equal. Who will understand women's problems and issues better than women themselves?
Dr. Ranjana, just to that point, who will understand women's problems best than women themselves? Just to drill the point of our conversation home, I want to pick up on that study you quoted, which showed a very strong link between women participating in democratic circles more and the decline in crimes against women. Why does that happen? Just to drill that point home, why does that happen?
When you accept women in politics, that means you are accepting the presence of women in public arena. When you accept her as leader, someone who you elect as your leader, then the general status grows in society. People start looking at women not just subjugated human beings who should be, who can be beaten up, thrown out of the homes, who can be, all kinds of violence can be inflicted on them, but you look up to them. And when you start looking up to them, you consider them as your leaders. And then that travels across the social, different layers of society. And people start looking up to women because they are able to deliver the development in the rural areas. When they become panchayat leaders, they are able to connect them with the local bodies which, can give them different kinds of schemes, projects, programs. And also that, you little bit fear them also. You fear them because you can't get away by exploiting them so then the whole paradigm, there is a whole understanding shift from looking at women as someone who's totally a subordinated human being, totally a dependent human being, to a leader. And that's where the whole shift happens about perception and also in terms of reality, because she's delivering in terms of reality, and your perception, how you look up to a woman, also changes the way women really are treated in family and also outside in the community.
Right. Dr. Ranjana Kumari, thank you so much for your insight there, such valuable insight. Thank you so much, Ms. Mariam Radak, for your insight. There's so much more to discuss when it comes to how important it is for women to participate in public spaces and the impact that has in trying to bring about an evolution of sorts within society in trying to decrease crime against women. There's so much to talk about there, and we were just scratching at the surface right now. But thank you so much for your insight and your valuable time to both of my guests. Thank you for watching Indus Special. We will see you again next week with more stories. Till then, goodbye and take care.